Good evening, everybody, and welcome to this evening's coronavirus briefing call. Tonight we're going to be discussing the government's response to the epidemic, and I am Representative Dean Phillips, and I'm pleased to be joined this evening by Senator Tina Smith and some very special guests, some of the very top medical professionals in the state of Minnesota, who we will introduce in just a couple of moments. Throughout the call tonight, everybody is welcome to ask a question of our panelists directly by joining the web stream at phillips.house.gov/live. Again, that's phillips.house.gov/live. And if you have to leave the call before we finish tonight, we encourage everybody to get the latest updates and information on the epidemic by going to the CDC website, which is C as in Charlie, D as in David, C as in Charlie, .gov. That's CDC.gov. And I think I speak for everybody when I articulate that we are feeling some fear and some anxiety and concern for our families, ourselves, and for the country. It's certainly unprecedented for most of us in our lifetimes. But I want to make sure everybody is aware that we are going to get through this. We will persevere, we are resilient, and we are very fortunate to live in a state with the resources available to do the very best we know how to protect people. And unlike some scares in the past, let me assure everybody on the phone tonight that this one is not driven by the media. This is entirely driven by our hospitals and medical professionals who are telling we in government and the business community and community leaders that they need our help right now. And in Minnesota, answering that call has led to some very tough decisions, as you all are surely aware. Yesterday, Governor Tim Walz announced that starting on Wednesday, schools in Minnesota will be closed. Just moments ago, some of you may have seen in the news that he just announced that beginning tomorrow, bars and restaurants will have to close, except they will be allowed to provide takeout service, just to make everybody aware. In Washington, D.C., just on early in the hours on Saturday morning, we passed a very rare but important bipartisan agreement that took a lot of collaboration between the executive branch, President Trump, and the House. And we are going to afford states the resources that states need to combat this disease. Real leadership is absolutely going to help, but everybody on this call tonight and everybody in Minnesota, every citizen, has a role to play if we're going to beat this back and do so quickly. We're a hardy people, and we are going to rise to the occasion, and I've been extraordinarily inspired by your generosity, your passion, and your willingness to do whatever you can to help our community. This is surely an important time. We will get through it. It is an extraordinary honor to serve each of you in my district and beyond, and we're going to get through this together. It is my honor and my privilege to introduce my friend and our wonderful Senator Tina Smith, who has been a leader in our state on this issue since the outbreak began, and she is working tirelessly to protect all Minnesotans. So, Senator Smith.
Well, thank you so much, Dean. I really appreciate that. And I'm so grateful for everybody who's on the phone this afternoon and this evening because you want to get good information about what is happening with the coronavirus and what you can do to keep yourselves and your family safe. I want to reassure you that for both Dean and me and really all of the members of your Minnesota delegation here in Washington, D.C., that our number one priority is to do everything we can to make sure that Minnesotans are safe in this outbreak of the coronavirus. And I want to just also thank the Walz administration and, in addition, the hundreds of doctors and nurses and healthcare providers and hospital workers and people that you find in the clinic who are doing so much every single day to help us all be as healthy as we can be in this really, really unusual time. I was just talking with my own family about this last night, and we were talking about how we're all in this together, and we all have a role to play in containing this virus and making sure that we're doing what we can do to help make sure that this does not spread farther than we want it to. So I'm grateful to have the chance to be with all of you. I'm thankful to Congressman Phillips for pulling us all together, and I'm eager to hear from the healthcare professionals that we have here tonight. The last thing I want to say is that if you're out there online or even watching television, you may well hear all sorts of information about what's going on, what's happening here, and I just urge you to make sure that you're getting the very best information that's based on science and medicine. And that is really what inspired Dean and I to organize this call this evening. So I'm glad you're all joining us.
Thank you, Senator. And to let everybody know, the Minnesota delegation, most of us were on the phone this afternoon, Democrats, Republicans, all with everybody's best interests in mind, everybody collaborating in a heartfelt and meaningful way. And I want everybody on the call to know that your representatives, both in the Senate and in the House, have everyone's best interests in mind and are not going to rest until we get through this all together. So with that, thank you, Senator, for your remarks. And now we'll get to our panel. I'd like to introduce everybody. And after I introduce you panelists, just do a quick hello, and then we will start the questions, and we will go from there. Starting with Dr. Kelly Searle, who's an infectious disease epidemiologist from the University of Minnesota. Please say hello, Doctor.
Hi, thanks for having me here. I'm an epidemiologist at the University of Minnesota, and I'm glad to contribute to this conversation.
Thank you, Doctor. Next, we have Dr. Rob Thomas, who is the President and Chief Executive Officer of the Emergency Physicians Professional Association. Rob?
Yeah. Thanks, Congressman Phillips, and thanks, Senator Smith, for including me in this discussion. It's quite an honor to be able to connect with as many my fellow Minnesotans to give them good information, and happy to do it. I am also a practicing emergency physician, just got off 2 shifts over the weekend. I'm representing really every emergency physician, every emergency nurse, urgent care clinicians, techs, paramedics. I'm the voice of everyone who is part of the front lines of healthcare today.
Thank you, Doctor. And last, we have Lisa Shannon, who is the Chief Operating Officer of Allina Health System, one of the largest health systems in Minnesota. Welcome, Lisa.
Thank you. It's really a pleasure to be here, and I am here to help communicate and share some of the preparation, not only at Allina Health, but what we are doing as a health community to come together and provide for not only keeping our healthcare workers safe so that we are available to take care of all the communities that count on us, but how we are working together to do so. And it's really a pleasure to be with you this evening. Thank you for including us.
Thank you, Lisa. So we're going to get right into questions, and I'm going to ask the first one, and Senator Smith and I will alternate. We're going to start with a question to Dr. Searle, who I will ask to give a comprehensive overview of where we stand in Minnesota right now relative to number of cases and where this might go, and what we can all do to what we call flatten the curve, which means slowing the spread of the virus so that our health system can match capacity to demand. So Dr. Searle, if you could give everybody an update of what we're seeing and what we might expect over the coming weeks.
Okay, great. So thank you again for having me. And like we mentioned before, I'm an epidemiologist. So what I study particularly is the distribution and determinants of diseases in communities and population. And so with this novel coronavirus, COVID-19, how we're seeing it spread in communities is by person-to-person contact. And what that means is basically droplet contact or droplet transmission between people through direct immediate contact and through surfaces that are shared between people. Where this stands right now is that it has shown to be incredibly transmissible in communities, which is why we're experiencing it here now and why this is such unprecedented times in having a global pandemic. And right now the situation is very dynamic, and I'm really grateful that we're having this conversation because things are being monitored in a very real-time fashion. And right now in Minnesota, we have seen over the past week, really, cases increased from our first documented case about a week ago to confirmation that there has been community spread to now having 54 cases in Minnesota at the last I checked this morning. And so epidemiologically, we do see that the curve is growing. So we are on an increase in the curve. And because of this, we are implementing control strategies in order to flatten that curve. So when we talk about physical distancing and social distancing, what we mean is trying to break the chains of potential transmissions in order to bring this growth of the curve epidemiologically down. So in order to reduce transmissions so that we do see fewer cases arising in the community. And also we want to reduce this curve and flatten this curve so that we don't see multiple cases occurring at the same time and presenting into health facilities at the same time so that we can protect the healthcare workers during this pandemic.
And doctor, who is based on all the international data that we have available, who is most at risk, and what can we all do as individuals to try to protect those people and flatten the curve as you speak?
Right. So right now, because this is a novel virus, that means that we haven't experienced it in the population yet. So everybody is at equal susceptibility. So everybody in the population is susceptible to infection. The severity of disease with that infection varies by age. So those at older ages and with underlying conditions are the most susceptible to the more severe disease presentations.
Okay. And once again, what can we each do? What practices should we start employing individually and collectively to best protect people?
So individually and collectively, the first is individually hand washing anytime you have contact with another person or a surface. Collectively and individually, we can implement these social distancing or physical distancing practices where it is best to keep 6 feet between individuals. So keeping a safe distance between individuals so that we're not having shared space, because this disease does transmit the virus by contact. And to increase spaces between people, you can limit the potential for contact between people and limit the potential for shared surface.
Okay. And one more question before I turn it over to Senator Smith for the next question. Many have asked questions about home deliveries. I get mail and newspapers, Amazon packages. Are those items safe to handle, or should they be isolated? How should people address items delivered to their homes?
That's a great question, because you can lose your contact with another person by having it delivered to your home. Are enclosed and basically surfaces that can have the virus on them if they were touched by somebody potentially infected. So what you can do with those things, mail, newspapers, if you're not going to read them, you can do kind of a one-touch. You can bring it in. If you're not going to read it, if it's junk mail, you can discard it in the recycling or the garbage, and then wash your hands after. And packages and things that come in cardboard, research has shown in a study in the Lancet that the virus can remain viable on cardboard for about up to 24 hours. So if something comes to you in a box from Amazon, you can take it out of that box and remove whatever that you need to from that box, and you can, if you're able to, wash it with soap and water to remove any potential virus particles or contaminants. And if you can disinfect it, then it's safe. And then the box that it came in, discard. And after you do all that, personally, then wash your hands before you start handling other things.
Okay. Thank you, Doctor. All right, Senator Smith.
Great, thank you. Well, I think from what we can see from all the questions that people are submitting, that a lot of people are wondering what they should do if they're feeling sick. What steps should they take? And maybe I'll direct this question to Lisa Shannon at Allina.
Yeah, thank you. We are getting that question from many, many sources, and we know the community needs to know, what do I do if I feel symptoms? And what we are asking is that the first thing is that you remove yourself from other people in your home. So if you are feeling ill, isolate yourself, put yourself in a different room, and we would, first step, either call your doctor, do not get in your car and go to your doctor, do not go immediately unless you have symptoms that I'll let Dr. Thomas speak to. But what I would suggest is we have through AllinaHealth.org an everyday free online COVID-19 screening interview. You can go online. It's available 24/7. It takes about 15 minutes to complete, and an everyday online provider will review this information, and they will email you the next steps. If you do not have access to that online tool, you can call your provider, and by doing this first step, we are trying to protect you from going into an environment, if you don't have the illness, where you may be additionally exposed. Dr. Thomas, would you like to add to the symptoms that might require people do something faster than phoning their provider or filling out an online questionnaire?
Yeah, certainly. I would just add, Lisa, that the way we are trying to manage patients with respiratory symptoms is markedly different than we were doing even just 2 weeks ago. So let's say you are feeling very symptomatic, and one of the challenges here is that this virus causes symptoms that are very similar to the common cold initially. It's very similar to influenza, although influenza may come on a bit faster. So it's very difficult for us as clinicians to differentiate the common cold from this novel coronavirus. So if you are feeling very ill, what would that mean? That would mean primarily very short of breath. So high fevers can be controlled with hopefully Tylenol, hydration, but if you are really struggling to breathe, that's when you need to seek in-person medical care. In those situations, it's likely that you would need to be presenting yourself to an emergency department. For things that are less than severe shortness of breath, with regards to the coronavirus, coming to the emergency department is likely not the right answer. So I can answer more questions about that. But when you come to the emergency department, either if it's by ambulance or by private car, you're likely to very soon find a segregation of patients. So there are going to be patients that have respiratory complaints like fever, cough, shortness of breath, will kind of go into one area, and other patients who don't have those symptoms will go into another. The reason for that is because this is highly infectious. We are still having to deal with the standard medical problems that are not related to the coronavirus, and we want to be able to protect those patients as well.
So, Dr.
hopefully
Thomas,
that's helpful.
Thank you, Dr. Thomas. And I was just thinking, some people might be asking themselves, like, what's the harm of going to the emergency room if I don't feel well? At least I'll have somebody to take a quick look at me. But what I hear you saying is that actually is not only could be harmful to yourself, but it also could be harmful to all the other people that need that do need emergency care. Is that right?
That's correct. And there's actually a third one, and that is the healthcare workers. So right now, we have a dedicated team of emergency providers, both in clinics, urgent cares, and emergency departments, and on ambulances, that also need to protect themselves so that we can take care of the sickest patients. And when you come in shedding this novel coronavirus in your secretions, you are putting our healthcare workers at risk, and you're putting a typically very vulnerable population of other patients who are in the emergency department at risk. So yes, that's accurate.
Mm-hmm.
So the answer is, if you're not feeling well, the best thing to do is to call your healthcare provider and get some guidance. And there's some really great online resources to help you go through a little series of questions to give you some guidance about what really might be going on with your own health. Thank you very much.
And doctor, before we get to the next question, maybe just go through again the most common symptoms that would indicate the possibility, at least, of coronavirus.
Yeah, so again, it's going to feel very, very much like early on, very much like a common cold. From reports that we are hearing from around the country as well as around the world, generally starts with a sore throat. Not everybody gets a fever. Only about 40 to 45% of people in that first few days of illness develop a fever. But as people get deeper into the illness, if their inflammatory response to the virus becomes very, very pronounced, then they begin to develop significant shortness of breath. And that's much to do with the inflammatory deposits in the lungs. And that's what causes the shortness of breath. Okay, so I would just also make a comment, if I might, that I would like to reiterate what Lisa was saying, that different parts, different generations of society feel either more or less comfortable with technology. This is one of those times when getting up to speed with potentially a digital interface with your provider, either an online survey or screening tool or a video visit. Trying to learn how to do that would be really important at this juncture.
Thank you, Doctor.
This is Lisa. I would just add to it to help the community find those tools. Nearly every health system where their doctor may be affiliated with will have a website that they can look for virtual visits, online visits. Everyday clinic is at Allina Health. You can go to an everyday clinic access, and those tools become very simple ways to navigate. Again, it keeps the healthcare worker safe, and it also keeps the patient or the community safe, because you are not going out into an environment where people may be more ill than you are and bringing the illness to you.
And if you don't, this is Senator Smith again, and if you're one of the many, many, many Minnesotans that doesn't have access to the internet, what you could do is just call your doctor, or you can call urgent care. Is that right?
Exactly.
Great. Thank you.
Great, thank you. All right, this is Representative Phillips again. Many of you submitted questions over the last few days and online over the last few moments about the economic impacts of this epidemic, and questions about what are we going to do to protect families from financial hardship. And I don't want to sugarcoat both the human impact of this and also the economic impact. They're both real, and it is our responsibility as senators and members of Congress to do our utmost to first ensure that our health system is resourced appropriately and we get through this stage of the epidemic, which we will. It is secondly a priority to ensure that families who are affected by it, individuals who might be laid off, who might be taking sick leave, unemployed, are afforded the resources to get through as well. It is also a priority to ensure that small businesses can keep their lights on during this. And then lastly, when we do get through it, it is a responsibility to ensure that we provide a stimulus, if you will, resources that will once again create demand and get the economy back on track so that anybody who may have been out of a job for a period of time will get it back again. That's how we're looking at this. The bill that we passed in the House a few days ago and the Senate is about to take up, that has the full support of the White House and President Trump, does really six things. Starts with free testing for the coronavirus to every single American, whether you're on a public insurance program, a private program, or have no insurance at all. And we will talk also about the lack of testing, which has been a big problem, as everybody knows, but that is being rectified right now, and free testing will be provided to everybody. We also established a paid leave program so that those who take leave from their jobs to avoid spreading the virus or due to their own illness or caregiving responsibilities can pay their bills. It requires businesses to pay them during the leave, but the federal government is going to reimburse 100% of that paid leave that is experienced. We strengthened the food assistance program with more than $1 billion to particularly ensure that low-income pregnant women and mothers with young children get support. Food banks and home-delivered meals to seniors will all be amplified. We provided resources to enhance unemployment aid to laid off and furloughed workers, as well as those who exhaust their allocated paid leave. We took steps to protect healthcare workers to the best of our abilities, and also to safeguard Medicaid benefits. We amplified what we call FMAP, which is the Federal Medical Assistance percentage, by 6.2%. So each state has amplified resources to care for those on Medicaid. We also passed an $8.3 billion bill a couple weeks ago that is going to provide extraordinary resources to help invest in vaccine and potential treatment regimens, which makes flattening this curve, extending how long it takes to spread the disease, really important, because if we can spread it out over time, we will have the time to develop these vaccines and treatments using those resources. Lastly, we're not done. We will do another bill in the coming weeks that will further support the economy and individuals who are suffering because of this epidemic. So we have your backs. We're going to do our best. Your ideas, your stories make a big difference to Senator Smith and to me, and rest assured we will listen and do our utmost to work with our colleagues in Congress and in Washington to get that done. Senator Smith, anything to add to that?
Thanks, Dean. I want to just reinforce that the bill that all of this legislation is passing with strong bipartisan support, which I think is a sign that Republicans and Democrats want to work together to take the steps that we need to take to keep Minnesota families safe and respond to this virus. I also want to reinforce how important it is that people will have the option, even if you don't have paid sick leave through your work, that you'll have the option to stay home and get paid. And that will be make a huge difference in our ability to control the spread of this virus, because we don't want people there are too many people that might be forced with the choice of going to work in order to earn their wages because they can't afford not to work. So I think we've made some really important steps in the last 2 weeks, and there's more work to do, but it's great to see this kind of bipartisan work happening.
All right, Senator Smith, question time for you.
Great. So I think that we've had a few people who have asked us a question about, what's happening with our food, and that we go to the stores and we find that shelves are empty, and it looks like we might be, there's just the worry about that. And so Dean and I wanted to be able to respond to that, and maybe our healthcare experts want to jump in as well. But we wanted to just reassure folks that the United States has one of the best, strongest, and deepest food supply systems of any place in the world. And part of what's happening right now is because people are feeling anxious. They want to make sure that they've got plenty of supplies at home, and so they're buying more than they need, and that's contributing to empty shelves that you see when you go to the, Target or Walmart or your local grocery store. And so, certainly that is putting some pressure on our grocery stores. I know my local grocery store has been working like crazy to keep the shelves stocked, but we want everyone to know that there's no reason to think that there's going to be a shortage of food at all as we go through this viral outbreak. Dean, would you like to add anything to that?
Yeah, and many are recommending, if you have the ability to have about 2 weeks of supply of food in your homes, just for in case of a worst case scenario, that would be helpful. Most assuredly, if there was some type of a disruption in food supplies, the federal government would do everything it can, which is quite ample, to ensure that food is available. The most important thing is people not hoard. That's unnecessary. But keep some supplies at home. And once again, a lot of restaurants, while closing to service in the restaurant, are going to be open for takeaway service as well. So in China, the only example that we can really refer to right now, they're in the worst of their days. There was about a 2-week disruption in their supply chain, which didn't mean there was no food, but just meant there were some out of stocks. And as we're seeing here right now with hand sanitizer and paper products, there have been some disruptions, but food manufacturers that I've been speaking with are ramping up their production, as well as those who make personal protective equipment for healthcare workers. So manufacturers are going to do their best to catch up, and I have confidence that we'll be just fine in that department. Our next question, we've received a number of questions about traveling and going out. And my question, starting with Dr. Searle, people are asking, should I cancel my travel plans? Should I go to my granddaughter's birthday party? How to best provide some guidance to people on the phone about how they should be looking at travel, and both near and far?
So, thanks. So for travel plans, I would say, should you cancel your travel plans? Yes. COVID-19 is able to spread really quickly and efficiently through this person-to-person contact. When we're traveling, it does inevitably increase our immediate contact with other people, whether or not we feel healthy or just a little bit ill, with maybe that sore throat. And we don't know about what other people, whether or not they're feeling healthy and what their symptoms underlying may be. And so when we're out traveling, we can be pretty effective vectors. And right now, when we do exercise, physical distancing and social distance, what we're doing is kind of decreasing our network of our immediate contacts. And when you can travel plans, you can kind of break those potential transmission chains. And so I would say, if you have travel plans, it is probably better to cancel them. And when you are thinking about whether or not you visit your family members, your own direct contacts, about how they play into your own social networks and how you are decreasing those contacts.
And I might add, I happen to be the father of two college students, two daughters. Both are returning this week from different parts of the country, and they recognize that while the risk to people their age is quite low, that risk to their parents is a little bit higher, and to their grandparents even higher yet. So what we're doing as a family is they're going to essentially take the next 2 weeks and stay close to home, and in fact, most of the time in the home, not be physically with their grandparents for 2 weeks, and use FaceTime and other digital ways to stay in touch and be in touch. But we're going to take the best we know how to do, and that's what we are recommending to others too. For the most part, young kids are not being deeply affected by the disease, but it doesn't mean that they're not being infected by it. And that is problematic if you have people walking around who don't have any symptoms, who might be carrying it. So to grandparents on the phone, if you want to be comprehensive in your protection, to be mindful of that and keep some distance for some time, especially now that school is out. That's how we're looking at it in our house. And I think, Dr. Searle, is that good advice?
Yeah, that's definitely good advice. And that kind of gets to kind of closing off your social contact to be kind of more the in-home. And if you are in-home, do home to decrease potential transmissions within the home, but to decrease contacts between particularly vulnerable populations and those that are not as vulnerable to severe disease.
So, doctor, let's say someone in a home that might have multiple generations in it, or even one or a couple generations, but someone is symptomatic with a fever or sore throat. What steps should a family take in their home when someone doesn't require hospitalization but is exhibiting signs of either flu or, in this case, coronavirus?
So if someone is within the home and they live in a home with other people of multiple generations, if that person is exhibiting symptoms, they should be isolated. My best recommendation would be to allocate one person in the home to kind of be the go-between, to check in on the person exhibiting symptoms, to provide to them care if they can't provide care for themselves, and to make sure that that home has, to wipe down surfaces, make sure common places are clean, decontaminated if possible, but to kind of be an in-between to remove the direct contact between somebody who is exhibiting symptoms and everybody else in the home.
Great, thank you.
I have a question. That I think is related to this that somebody has asked, this person is asking if I'm 71. This person is 71 and in good health. They ask, are they at greater risk than the general population of contracting this disease? And maybe that's a question for Dr. Thomas or Kelly Searle. Dr. Searle.
I can start, and I definitely would invite input from the clinicians. Epidemiologically, the evidence that somebody at 71 in good health still is at increased risk for severe disease. Everybody, something that we should remember, everybody in the population is susceptible to infection, but those of older age are severe disease and complications. And part of the social distances and the recommendations at this point are to avoid these contacts to slow the spread and protect those at higher risk of severe disease.
Thank you.
Yeah, and I would just add, this is Dr. Thomas, I would just add that, a 71-year-old who has no significant chronic conditions, either lung disease, diabetes, heart disease, high blood pressure, if they don't have any of those other chronic illnesses, then that 71-year-old is much more likely to do well if they were to contract the disease. But hard to know, how their immune system will respond, because I think what we do know is that the immune system does weaken as we age, and I think that's why we see such a difference in age-related complications.
Mm-hmm.
Thanks very much.
All right. There are some questions about is there a risk of the virus mutating into other versions? There are some questions about what possibilities might be on the horizon relative to treatments or a vaccine. Perhaps, Dr. Searle, you might start with perhaps articulating what we might be seeing on the horizon. and when?
In terms of a vaccine?
Treatments and vaccines, yes.
So far, we are still a long way off from a vaccine, to be honest. There are indications now that it could be possible. I think this morning there was a release that a vaccine was entering into the trial phase, but the development and trial for vaccines is a very long process. So I think that we're still a ways away. It is nice to see that could potentially be shortened because one is now in trial, but I think that in terms of a vaccine, I think that we're a ways away. I haven't seen anything in the literature and so far that's in development in terms of a treatment.
Mm-hmm. And also, Doctor, some people have written notes both in advance and this evening asking, are we overreacting to this? One question, another, why is this different than H1N1? Do we really have to close restaurants and schools and stay close to home? How do you, as an epidemiologist, answer people who might not be convinced of the situation?
So I absolutely don't think we're overreacting. I think that right now we are kind of in an unprecedented situation. This is a global pandemic. We are not overreacting. This is very serious. But that does not mean that we need to panic. We have a really fantastic health department here. We have fantastic health facilities, and we are working together to get through this. But when I say this is serious, that it is different than anything that we've seen before. It is coronavirus or COVID-19 is transmitting very effectively. We are seeing very fast transmission. The incubation period or known exposure and onset of symptoms is about 5 days. What this means is that it can be transmitted fairly effectively before people are being documented as cases. And so it's different than H1N1 because it transmits fast, it transmits effectively, and right now we're seeing variability in the severity of disease with those more vulnerable and older populations, and we're seeing different presentations. So it is it's serious, and I don't think we're overreacting. I think that we're acting in order to be proactive about this.
And Rob and Lisa, do you agree with Dr. Searle in terms of the seriousness of this, or any other comments to add to Dr. Searle's comments?
This is Dr. Thomas. I would say absolutely that this is different, and it has everything to do with what Dr. Searle has said, that nobody has immunity to this. So while influenza is, yes, it spreads very fast, and it can involve large swaths of the population each year, and does. Unfortunately, people do succumb to complications of influenza every year in large numbers. The vast majority of us have some degree of immunity to it, and so our immune systems can respond quickly to that exposure. This is it's different. I think we are absolutely not overreacting. Emergency clinicians are used to handling emergencies, dire situations, and our entire community is worried. We're worried about our patients' safety, and we're worried about our own safety, frankly. But we're still going to be there. We're still going to show up. But it has us worried too.
And Lisa, your perspective?
Yeah. Yeah, thank you. I would agree with all the comments made, and I would add a couple things. As a community of healthcare providers, we are all working very hard to prepare for what is very, very different. And some of the comments made earlier of why it is so important for people to do their social physical distancing. We have to slow this spread. We need to slow it because we don't want patients to receive this illness, and we need to ensure that our healthcare providers, our hospitals and our clinics, and all these clinicians are available to take care of people with heart disease, people with cancer, and people with this. And so we want to make sure that we are available for all of you. And the last thing I would add is you care for yourselves and your family, and we talk about social distancing, which is in the media a lot. Remember, that is physical distancing. We are not asking you to isolate. This is a time to phone people, to have, if you have technology that allows for you to video visit with people. We can be in this together, and you can reach out and support one another without being physically near someone. And as we take care of each other that way and work through symptoms, we can slow this spread, but it won't slow unless we follow hand washing, this physical distancing, protecting your families. We need your help.
I just wanted, this is Senator Smith, and I really appreciate that comment. I want to note that, many of us have family members or loved ones that live in, assisted living centers or nursing homes, and they're being, we know that for their health, that it's better for us not to visit them. And we need to remember, it's such a great point, how we can figure out ways of connecting with them so that they don't get really isolated in this unusual situation. And so that idea that we need to be thinking about maybe physical distance but not emotional distance, I think, is a very important point. So thank you for that. So listen, we have a lot of questions around the question of testing. And I know that both Congressman Phillips and I have been pushing very hard to expand access to testing and also to make sure that everybody has that there's access to testing that people can afford, that, as Dean said, that they're out-of-pocket costs for the process of testing people don't have to bear. But I'd like to hear, we have many questions about this from folks online about how is testing going, who should be looking to get a test, and what's your view of how the testing process is going right now? And I'd like to hear from really everybody, maybe starting with Lisa, Shannon, and Allina, because I know you all are on the front lines.
Yeah, so I'd like to reiterate what was said earlier. Not everybody needs a test, and candidly, we don't have adequate supplies to test everyone. We are working really hard with our local government and colleagues like both of you and other federal agencies. We need to test the people that show signs as directed to us by our physicians. Being able to talk to your doctor if you think you have symptoms, or again, going online to have a free screening if you have access to that, will help us test the people that need it most, because testing we don't have enough supplies yet. There is a turnaround time for those tests, and we are testing as quickly as our supplies and capacity allow us, and we will keep getting better at this. But I would begin by following the direction of your physicians and seeking their advice.
Thank you very much. Would anyone else like to help answer that question?
I can weigh in. To Lisa's point, right now we just don't have enough access to testing, and we are experiencing many frustrated patients that come in through multiple venues, And sometimes, that you get the impression that they think we're withholding something, but in fact we don't have the ability to do it. And I think that's as frustrating to a clinician as it is to a patient to just not know. So really, the recommendation that we can make now is, because symptoms are so similar at the outset of these illnesses, whether it be a common cold or COVID-19 novel coronavirus, it's if you feel ill, you need to instigate these measures, which I think everybody ought to be doing already. Mm-hmm. So I'm hopeful in the things that I read. I'm hopeful that we will have increased ability to test, increased outlets to do that testing, so we can really just identify what this disease is doing. Mm-hmm. But for the time being, we're exceptionally limited.
And this is Representative Phillips. I want everyone to know that Senator Smith and I have been asking questions since the very beginning of this circumstance about why testing wasn't more widespread and available around the country. We still don't have good answers. I will say, and as many of you know on the call, that Senator Smith and I have not been in Washington long, and we are identifying many areas that need improvement in both the congressional area and the executive branch. Dr. Tony Fauci, who many of you have been watching on television, who's the director of NIH, the National Institute of Health, and is probably the best spokesperson right now nationally on this, advised some of us the other day that we do not have a system designed to accomplish what we need to do now. We should have, and we need to, and we must, were his comments. So our nation is playing catch up. It's not the time to litigate or debate why. We have to be prospective and try our very best, considering the current circumstance, to amplify those tests, get them around the country, and most importantly, share transparent and actionable information with every single one of you, so that you know what is going on, why it's going on, and how we're going to get through it. But rest assured, both Senator Smith and I are asking the tough questions, and we'll do our utmost to ensure that we are better prepared as a country in the future. With that, everybody, we are now we're 5 minutes to 7, so I'm going to ask each of our panelists just to make some closing remarks, if you would, and then Senator Smith will make remarks, and then I will close. But starting with Lisa Shannon from Allina, if you might make some final remarks.
Well, I want to start by thanking.
Are you there, Lisa? Hello, Lisa? Oops.
This is Lisa. Can you hear me?
Oh, there we go.
Oh, my apologies. Well, I had shared that I wanted to begin by thanking Representative Phillips and Senator Smith for putting this call together, and for my colleagues on the call. This is new for all of us. It is a new and wildly contagious virus that we are all working together. And as I mentioned earlier, both taking care of patients in the community as well as keeping healthcare workers safe and healthy, so we're there for you, is our responsibility, and something we are working and planning for greatly. And we will continue to be in a partnership widely through our community. Thank you.
Thank you, Lisa. Rob Thomas, Dr. Thomas.
Yeah, I'd also like to thank you for allowing me to participate. One thing that occurs to me about people who are not in healthcare, they may see it as kind of a black box and think that healthcare providers have all the answers. In this case, we don't. We don't. There are no secrets. There's no secret treatment that that you might get if you show up in an ER or a hospital. We're anxiously awaiting our scientists and researchers to come up with something that helps us, because there's nothing that is sorry, getting emotional. There's nothing that excuse me. There's nothing harder than being a caregiver that can't help. Sorry.
okay,
It's
Rob.
been an emotional time for everybody on the front line.
We're grateful. We're grateful.
We're so grateful for your work.
Yes. Dr. Searle, would you like to make some closing remarks?
Yeah. So thank you so much, Representative Phillips and Senator Smith, for allowing me to participate in this. It is a real honor to participate in this, and I really appreciate that we're bringing science and healthcare and policy all together, and hopefully this does kind of bring us all together. And I do want everyone to know that the measures being put forth and everything we're doing, it's for everybody's individual health and for health and public health. And so I'm really grateful for you all for doing this, and for everybody that's calling in and participating in this. This is hopefully we've been able to be helpful and answer your questions and be a source of information and alleviating some concerns that you may have right now.
Thank you, Doctor. Senator Smith.
Thank you, Dean, and thanks so much to Rob and Kelly and Lisa for participating in this, and especially to all of the Minnesotans that are on the phone tonight to get good, factual, up-to-date information about what's happening here. And I just want to end where I started, which is that for Dean and I, our number one priority is to do everything we can in Washington to protect the health and safety of Minnesotans, and we have that in our hearts and minds every single day. I know that everyone on this call has gotten good information, not misinformation, and that is so important. And I think you all, I hope, have gotten the real feeling that we're all in this together and that we all have a role to play in stemming the spread of the coronavirus and the COVID-19 disease. And I just look forward to working with all of you going forward. And I'm so honored to serve you in the United States Senate and to do everything I can to keep us safe. Thanks so much, Dean.
Thank you, Senator, and thank you, Lisa. Thank you, Kelly. Thank you, Rob, and thank you to the many thousands of you who are still on the line tonight for taking the time to participate, and to our respective staffs who helped put this together. And we received hundreds, literally hundreds of questions during the phone call. We will be following up with you. Any questions that weren't specifically addressed on the call, we will follow up with you. I know Senator Smith and I both are keeping our phone lines open. You can reach our offices by going to our respective websites and calling. You can send emails. We are, I believe, both practicing teleworking now in our offices, as we are recommending many businesses do now and enterprises. So our people are working full-time, in fact, more than full-time, but often at home or remote locations. So we are part of the solution, not part of the problem. You can also always go to the CDC website, which I announced earlier, C as in Charlie, D as in David, C as in Charlie.gov. There will be updates there all the time. And I hope everybody learned something tonight. I surely did. I've never been more proud of my community and grateful to be a native son. We are an unusual state and an unusual community with one of the most extraordinary healthcare systems, not just in the country, but around the world. And I encourage everybody to remain hopeful. Optimism is contagious, too, and this is a great time to practice that and spread it. The days ahead are definitely going to be challenging, but we're strong. We're going to persevere, and we will find lots of creative ways to adapt. And I know that school closings and restaurant closings and physical distancing and changes to our routines certainly cause some uncertainty, but it is absolutely the important and pragmatic way and the responsible way that we're going to protect our healthcare professionals and ensure, this is all about ensuring that our healthcare capacity is not exceeded by the demand. And that's where we all come in. If there's a closing message of great importance, it's that good governance and good government can do a lot for us, and we will. We're going to be there for you, you who might lose your jobs, you who might need extra health care. We will be there for you. But to succeed, we all have to do it together, and that's where all of our individual decisions are going to play a role. And one of the questions that was submitted this week was from Misty Ritchie in Champlin, who asked how I can help in my community. How can I be available to shop for the elderly or otherwise compromised people? How can I help deliver meals, perhaps, and help those who might be quarantined? I don't have an answer for Misty right now, but it's that spirit that we all need. We need to protect ourselves and our families and friends and neighbors. But this is going to take an all-hands-on-deck and all of Minnesota response. And Senator Smith and I and your other representatives will be issuing ideas and opportunities to be participants. And we also ask that you share your ideas. Faith communities, neighbors, friends, and families are going to shine because that's what we do in America. And I am so grateful to all of you. So thank you for your time. And most of all, keep the faith. This is the time we need it, and we're going to get through it. And I anticipate that we might try to schedule another one of these over the coming weeks as circumstances merit. In the meantime, Senator Smith and I are going to get back to work, and I will close by expressing gratitude to every healthcare professional in our community, our state, our country, and around the world. There is no army of people more important than them. So when you have a chance, thank your nurse, thank your support staff, thank your healthcare executives, and thank your doctors, because they're doing yeoman's work, and they will be over the coming weeks until we get through this. So Godspeed, everybody. Heartfelt thanks, and keep the faith. Bye-bye.
Bye.